Good afternoon, everyone. Hope you're good. Oh, I feel rather naked all of a sudden without my little frame round. There we go. That feels better. How are you today? I've been not putting the music on for the intro on some of these shows just because it's been blaring out in people's ears, but we've still not sorted out the new one. It needs tidying up. So instead, you've just got me suddenly appearing, which I hope you don't mind. I hope you can hear me okay. Obviously, points and prizes for whoever is in the comments telling me whether they can hear or not, but I'm going to proceed assuming things are working. Things were working backstage. I've just been chatting to Gillian, who's joining me today to talk about animal physio. We've just been having a laugh about how we talk about animal and human physio as if that's the patients of which are being treated, not the actual therapist. As interesting as it would be to try and turn an animal into a therapist, we're not quite there yet. That might be something to, if I got stuck for questions, then I'll have to drag Gillian into that, which would be a weird conversation, wouldn't it? But instead, we're going to talk about research, we're going to talk about education, we're going to talk about all the interesting inquiries that I've had from you lot since we had Fiona Bloom on the show. And then Leanne had a lady called Kim talking about animal physio as well, which I haven't watched that show yet, which is criminal. Sorry, Leanne. Sorry, Kim. But lots of interest in this subject and how you get into it, what the types and shapes of people that get into that, as well as what the similarities and differences are. So hopefully, if the technology is behaving itself, Fiona's points and prizes to Fiona for letting me know that she can hear us okay. Oh, here's loud and clear, and she says, looking forward to it very much. So thank you for joining us, Fiona. Really appreciate that. A couple of clicks. All right, let's get rid of me frame. And hopefully, Gillian, can you hear me?
Yes, I can. Hi, Jack.
Fantastic. Well, thanks for joining me today. Really appreciate it. As we just said off stage, nearly say off air. Really, I've still got loads of questions that I've got, but also that have come from our sort of network of people that are sort of, it's clearly got their eyebrows raised. They're clearly interested. They've not really thought about it before, but now they really are. So maybe this will further fuel that fire. Could you tell us a little bit about your background to start with, though, and how you've ended up in the position you have? You can define that as well.
Oh, yes, of course. So I actually graduated in 1998, it's quite a while ago now, but I always knew that I wanted to go in to treat animals. So that was why I did my undergraduate degree, actually. My dissertation was on the perception of veterinary physio by vets at that time. And pretty poor perception at that time. I'm glad to say it has improved over the last couple of decades. So I qualified, I went into my junior rotations and then was able to go part-time, and then I completed my master's in veterinary physiotherapy at the Royal Vet College, and I was lucky enough to be one of the first sort of cohorts that did that, and that was sort of starting sort of my journey really into research and into sort of clinical practice. So I combined human practice and animal practice for a little while before being asked to actually lecture on a rider performance module as part of an undergraduate degree. And I enjoyed it so much that I sort of looked to see what else I could do. And then Hartpury University was increasing the numbers of students that they were taking. And in 2013 I joined them. And now I am a programme manager at Hartpury University, combining that with my own practice in Devon in the UK.
So if you can just help me with the geography a little bit. Hartpury, not a massive university town, so hopefully I can be forgiven for not knowing it there. But whereabouts, what sort of size?
So we're in Gloucester, and Hartpury traditionally is a land-based college, but it's now expanded to have sports, agriculture, equine, vet physio and vet nursing programs there. We transitioned to being a university a few years ago, and we now have our own undergraduate and postgrad taught programs, as well as working with UWE in Bristol for our postgrad research degrees as well.
Fantastic. And so not a place in which you've got then human physio course, animal physio course, it's very much sort of specialized there. What's the if I can get stuck into sort of the profile of some of your learners then, like what's the typical time frame of which they've been in human physio? Is that a mandatory prerequisite, which I know it is for ACPAT, but how does it go with the course and stuff?
Yeah, so there's probably no typical. I think that having interviewed a large number of students that want to join our program, everyone is motivated by their love of animals. I think that is what draws people into the profession, and they want to really be part of a hands-on, a real sort of one-to-one type of course, as much as they would do, with their human physiotherapy. So we have students that are recent graduates, and they've always known they wanted to do it, like me. I went into this route specifically to become a veterinary physio, and they bring with them a lot of sort of academic knowledge and academic skills, and are very capable students. But also we have some students that have been out in practice for many years. I've got students that have been graduated, well, actually a couple that were graduated longer than me. They're older than I am now, and they bring with them their clinical skills. They are amazing. Their communication with the owners, with the animals, and also obviously their physiotherapy application is just excellent. So there's no real barrier to entry. I mean, our prerequisites are you have to be a chartered physiotherapist, you have to be a member of CSP and HCPC registered, but it's really applicants that want to get back or to change their route through physio. I think that's what gets them into applying to Hartpury anyway.
And with that, are there? Because I'm really pleased to hear it's sort of there isn't a typical type, but I think that let me just spit out a stereotype and you tell me why it's wrong, or that it maybe is a subset, and that is someone that is very much grown up around animals, particularly equine, sometimes even canine, but more generally speaking, you've said the love of animals, but also that then, because it's hard to know chicken and egg as to whether or not their love of animals meant that they surrounded themselves with them even as a kid. But there's also those that did grow up on a farm or had horses or rode horses or kept dogs. So is that me being too stereotypical, or is that a large profile of people that would be interested?
I think it's certainly a proportion of our applicants. However, we don't have the requirement that they have to have ridden to a certain level or they've had to have those experiences. We need our students to be comfortable and confident around the animals to start with. So it's not something that we have to look for specifically. Gotcha, I think the obviously the minimum requirements is safety for the physio and the welfare of the animal. So you don't have to have been at high level beforehand.
Yeah. And would you say that, we'll get into the similarities and differences a little bit, which is sort of a same question to contestant number 2, because I did ask Fiona this about human and animal physio and stuff, like how helpful is it? You guys clearly think it is because of the prerequisite that you make over that. So what is it then you'd say are the key similarities and differences?
For us, when we're working with animals, obviously we have to acknowledge that communication is potentially difficult with the animal. And whilst we don't have verbal communication, we have to rely on our learning, our experience and our knowledge of animal behaviour and their pain behaviours. So I think we can think about the similarities in terms of, it's the same physiology, it's the same musculoskeletal system. They suffer from pain like we do. They suffer from degenerative conditions, athletic complaints. That is something that we have to consider. What did you say about the differences? I don't know. I don't see it because our scope of practice as human practitioners is actually, we problem solve, don't we? We look at what's in front of us and unravel what is the issue and then address it in many the same way.
So aspiring your patient, regardless of whether human or animal, to improve their function is going to be central, isn't it? And that's what's certainly interesting to me, and I can imagine it being a really rewarding thing. Do you think, because I've understood and witnessed it even on a sort of business level, that there's like a horse and rider ends up being the same therapist and stuff, and I can see that being really useful, obviously not just for business but also just for access and interest. Would you say most then practice both? Do some go, trying to get, aspiring to be animal physios in such a way as to reduce their human caseload? How is it typically balanced?
I think that again is not typical. Right. I have graduates that will only see a few animals a week, and that's their preferences. Where I've had those that as soon as they've qualified, they've handed in their notice and they are going head first into animal practice. When I graduated, there really weren't any employed jobs as veterinary physiotherapists, so I went out and built my own business, and so I transitioned from a high human caseload, and that reduced as my animal caseload increased. But now we've got jobs. Kim, who was on, you mentioned her before, so she works in a small animal hospital, and so they have inpatient physiotherapists that work purely with them, and in some practices in the UK they are employed by the vets. So there's more scope now to come out, graduate, and then go straight into full animal practice.
Let's get stuck into the research for a second then, which I know is music to your ears. Some people they'd start shaking, but that's your world, isn't it? So what's been the sort of progress over our understanding of what is evidence-based, and what's been the movement in animal therapy?
Well, when I started, it was very limited. 20 years ago, there was, I think I referenced an article on snake physiotherapy and elephant trunk physiotherapy, and that was about it. And there was a lot of denial about the fact that animals needed sort of musculoskeletal care in addition to veterinary intervention. But now, if you go onto the search engines and look into treatment of back pain in horses or in small animals, when we think about post-surgical physiotherapy, we have got increasing support, and the evidence base is growing, I think, more rapidly probably in the last 5 years than it has over the last couple of decades.
And so with that, obviously, and obviously I wear a MSK hat in the main, but fortunately, rehab has been something that I think transcends all the disciplines, and it sounds like it includes yours. But have things moved similarly in that direction with regards to being more rehab focused and understanding sort of physiology, aspiring to improve function rather than it being sort of algorithmic and interventional, or is it more of a mixed bag?
There's a mixed bag in terms of looking at sort of manual therapies and electrotherapies. I think there's more emphasis on that with animals still than perhaps there is now in the human field. However, in terms of the biomechanical studies that are looking at the kinematics, the effect of our interventions from an exercise therapy point of view, that's probably where the growth has occurred.
I think that it makes sense as well for it to be more interventional in a classic sense, because of the way you can't be particularly targeted. I won't fancy giving a horse a set of squats to be really targeted to, say, a knee problem. Whereas, so therefore, to administer something. Now, I know there are ways in which you can manipulate that, and I definitely want to bring that specificity question to bear. But it's more that you can make sense of the particulars of how careful you can be with exercise therapy and equipment use and stuff like that with humans. It's mainly a downstream effect of communication, isn't it? You're able to be more specific. So let's get into a classic sort of set of, even if it was just a list of, what would you be the scope of practice interventionally with animal physio? Let's go horses if you want to, or we can go broader.
Exactly the same as human practice. From a manual therapy point of view, I can impart mobilization to spinal segments just as much as I can in a person, and I would follow the Bialowski model of neurophysiological effects. I'm not putting anything back into place. I'm not manipulating pelvises, anything like that. I'm sit very firmly in the, I know what I'm doing with my hands, and that's not it. But we have got evidence that we can change spinal kinematics when we do that. We've got changes of mechanical nociceptive threshold. So, we use pressure algometers to objectively measure pain responses, and we know we can change those with hands-on treatment. And we've got electrotherapies that have crossed over from the human world. So I can use neuromuscular electrical stimulation. We've got evidence to use radio frequencies. So Indiba machines have been used in animals, and we're gaining knowledge about how effective they are. We've even got studies that have measured tissue tissue temperature raises using ultrasound. Those have actually been performed in the backs of horses. Right. So we have got primary RCTs in our specific species. And then in terms of the exercises, we can be targeted. You would talk about squats, but if we think about loading the joints through flexion, we can get horses to step over things and on things, and we can use EMG, and we can use force plates. I think it's probably harder in clinical practice to gather the objective data. That's a little bit of my bias where my research sits, but from a research lab, from a biomechanics labs, at Hartbury, we've got Qualisys, we've got 3D gait assessment, we've got inertial motion sensors that we can stick all over horses. We've got treadmills. There's a lot that we've got to be able to actually evidence. Yep, we've got a horse dry treadmill. Wow. and we have a water treadmill as well. So amazing. I work with a colleague at Hartbury, Dr. Catherine Nankervie, who's looked extensively into the effect of water treadmill in terms of affecting limb motion, spinal motion, longer term having an effect on sort of outcomes post-surgery. And we do have support behind what we do.
Brilliant. Yeah, no, I certainly had heard about the sort of research moving in that direction for sure. But my naivety of horse treadmill, hydro, certainly something I've heard a lot about and stuff. And stuff. That's popular. Just as the facilities are decreasing for humans to some degree. But pleased to hear that that's still up and very popular for.
Yeah, in terms of rehab, I work with yards down, I'm in the southwest of England. I work with a yard that we refer to that will put a horse on the water treadmill because we can influence the movement with the height of the water and the speed of the belt and the posture of the horse. So you were talking about communicating with your human patient, but with the horse, we have to sort of do it through external cues, if you like, to try and create activation of the right muscles, because obviously if we want to try and strengthen them and gain muscle mass through hypertrophy, then we have to get them working. So there are things like using a treadmill, or we use training aids on the horse, or specific ways of moving them to actually activate the right muscles. And we've got EMG studies that measure rectus abdominis activity, and so the equivalent of the rectus spinae, which is longissimus dorsi in the horse that we actually sit on, and show that we can influence them, we can make them work harder doing something.
That's brilliant. I think how well does it travel between, say, species? So if, like, say, I can imagine a tendinopathy in a racehorse, and I can imagine that what you would therefore be aspiring to do to improve load tolerance, etc., in that would not be dissimilar to in humans. What about, say, does that travel well to a greyhound, for example? And then am I, or any species of dog?
With the interesting thing with dogs is they generally have a much greater range of motion than a horse would have. They sit and they lie, and the spinal range of motion is much bigger than a horse. And of course they're a lot lower mass. If we think about a horse galloping, they're putting 3 times their body weight through one of those tendons. Oh, got my maths probably wrong there. Don't strike me off the record for doing that. But there's a lot of force. There's hundreds of newtons going through the tendons in the forelimb of a horse, and not so much in the dog. And of course, in a horse, with their ungulate, so they have a single bony column. They have their 3rd metacarpals, whereas in the dog we've got 4 metacarpals. So there are differences. And the other issue we have with animals is they might not necessarily tell us when they're getting the early onset of signs. When you've got a tendinopathy and it's just niggly, the animal might necessarily not tell us. So unfortunately, with horses, we do tend to actually have a full-blown tendinitis, or potentially fibre rupture later on, because we might have missed those early stages. And actually, I should put a plug for routine or maintenance physiotherapy. So I've got a lot of clients that I'll see on a rolling program, maybe 6 weekly or every 3 months, so that I can go in, I can assess them, and I can look at the gait. I'm very familiar with their movement patterns as a baseline. So if there are early signs of something, then we can pick it up way before it becomes fairly catastrophic when you get to horses.
That's fascinating in many ways, but I can so imagine the vulnerability that the industry has to those that are underqualified and overtreating, sometimes hand in hand, really, there, because of the way in which that becomes the preventative methods. Now, in sporting circumstances, we have that whereby people have got a team of athletes that are going through screening processes. We've had proliferation of, say, groin squeeze tests and Nordic hamstrings that they'll do on a certain basis, and then they'll notice that preemptively that drop off. Why is that underconfident? And still a emerging evidence base to try and get ahead of something on primary prevention. With you guys, I imagine it's not dissimilar in it being an art meets science type thing. But how do you personally protect yourself from going in and being like finger to the wind and being overly subjective and making sure that you are justified in your interventions?
Well, for my doctorate, I studied objective measurements in equine physiotherapy. So I am all about trying to be objective, because you're quite right. It's no good if we're just saying, oh, yeah, I think it's better or I think it's worse. And here you go, I'm a private practitioner. Here's my invoice. I'm going to come every week to come and see your horse. So I'm all about being objective as possible. And as part of that, with ACPAT, we have actually drawn up some clinical guidelines with regards to assessment. So we have brought together the best evidence that we have at the moment for these screening tools, if you like, in terms of palpation and gait and range of motion, so that we can try and sort of stand firm in front of our veterinary colleagues and anybody that is questioning us and saying, no, look, we are trying to be as objective as possible. It is an art as well. The owner is telling you there's something not quite right, and we are sort of part of the process of trying to unravel what's going on. But I think we are moving as well, certainly fast in the last 5 years, towards actually being able to stand up and say, no, we can measure this and we can measure it objectively, and this is where we're at, and we're not making it up.
Well, I think you can make sense of it as well with these are often well photographed and well videoed athletes, and that's something that this understanding a baseline and a movement from baseline. Now, you don't want to then just pathologize that, like we don't know adaptation, habits, that sort of stuff, but you can make sense of that if you know and you're familiar with it. I think the thing that everyone gets a bit squeamish with is when someone is even in humans, they're implying causation to something that they've just happened to find. Now, one of the things that I want to ask is, I have certain instincts based on probably some would call cynicism. I'd say just healthy skepticism in my own game, whereby you hear of a story. I went for a checkup because and I was told these things, and it was sort of this pathologized movement that they're unfamiliar with that person. And then I want to see how well does my skepticism there carry over to animal, because I heard years ago now, but I worked with a colleague of mine who was a horse rider but not a horse physio, who then said, actually the yard that I go in, my horse is, they have this absolute unit of a bloke. He's about the height of you but better built, and he comes over, and I think it may be an osteopath by background, and gets underneath the horse and was implying, and everything was a pelvic torsion, and she was laughing because of course that is the sort of cliche in the human game as well. And I'm not just smearing osteopaths on that, of course there's brilliant ones, but it was just this idea that where can't you find a pelvic torsion? Now, you're doing that in a horse, and then also he was saying the self-selection to the fact that this bloke were getting a sweat on, manipulating a horse and stuff. It was sort of like you had this physical bar that you needed to clear in order to do this magic sauce that he was doing. Now, is my skepticism there applied appropriately, or am I being too cynical? And there is something there in the horses.
Keep being skeptic. Honestly, there are back people. There are those that come in and tell you, your horse is out. I need to put the pelvis back in. I need to put the pole back in. And look what I've done. Your horse is amazing now. I fixed it for you, and here's my invoice.
See you next week.
And that is as frustrating to me within the profession as it is to you. And it's an embarrassment, because what it does is it builds a barrier between us and, we're trying to be evidence-based, we're trying to be objective, and then our veterinary colleagues, they're just going to laugh at us if that's what they think we do. Fortunately, I think through all the good work that ACPAT has done, we are sort of fairly well recognised, and there are other practitioners out there that aren't ACPAT that are absolutely amazing as well. But I encourage my students to actually start to develop the relationships with the vets that they want to work with really quite soon, and to build that confidence and be able to communicate and explain what they're doing and why they're doing it, and also stick within our scope of practice. If I see a horse routinely and it wasn't lame and now it is lame, then I'm going to be on the phone to the vet to say, I'm not happy about this, can you come and see it? And we work together. Or conversely, I get calls from the vet saying, this horse is lame in 3 legs. I have to say, quadrupeds are masters at compensation. We know this. If they're lame, they usually have back pain. If they're back pain, they're not moving so well. So that's something that we have to address. But if my vets that I work with will phone and say, can you help me out? Let's work on the sort of soft tissue, the muscular compensation, and let's see whether we can work out the primary pathology. Where is it coming from? So it is a problem, this issue with the back person going to. They usually have a very good sales technique as well, and that's something I've never managed to market myself as well as some of these guys are able to. I just think the more of us that are out there trying to spread the word about where we sit within the team and where we don't cross that line, I think the better it will be for us as professionals.
Well, it's so similar, isn't it? It's just aspiring to be credible. And then it's like, well, what is the governance structure and educational process? And how do we set sensible thresholds that don't exclude for quality, but then do make sure that we're in a situation where we can work interdisciplinary with the vet colleagues, etc. I can so imagine that challenge. And it sounds super familiar. It's one of them where you just definitely don't want to. I'm always a bit nervous because I think I've made this mistake in the past where you don't want to squash innovation, but you just need to make sure that things are feasible and that they're then tested and that we don't make bold claims that can't be backed up. And especially when you've then got literally the horse can't turn around and say bullshit, especially when they know bullshit when they smell it, of course, as animals. So I should have worked a better punchline into that. But essentially, that process is something that, therefore, and I know I mentioned this with Fiona, and it really got me thinking afterwards about just how the vulnerabilities to abuse that is, both of wallet and of animal, is just something that I know you guys are so right to be hot on and passionate about. So tell me about how you go about, both as ACPAT and as the universities, how you go about correcting for some of that and controlling for some of that.
Well, we try our best. I think it's about education, and it's about really trying to market ourselves as being in the professional area, the professionalism, the communication, and I don't have the answer to it. It is very frustrating, and one thing that I should just point out is that we stick to our professional practice standards as much as we possibly can, and they transfer from the CSP into ACPAT quite directly. And we are open to complaint. We're open to people who are clients, or hopefully not the ones that I work with, but they can go to ACPAT and they can say somebody's not working appropriately. And what is very frustrating is that we are governed by the Veterinary Act, as all professionals should be who are working in this industry. But those people that you mentioned that are out there are probably not insured. They've got no professional body that they're working with, so there's nowhere for them to complain to. The only thing that you can do is, if they are marketing and advertising themselves, there is the ability to go to the Advertising Standards Agency or to the RCVS, which is Royal College of Veterinary Surgeons, and then see whether you can get them as a sort of higher power to sit on them and ask them to stop.
Sure, yeah, and that's a long game, isn't it? And also, we're all just, especially we're in care professions and stuff, so we end up skewing towards being polite. So you end up just there's a lot of room to get away with stuff. So I'm really pleased to hear that there is a credible way in which people can aspire to study and to meet thresholds that are appropriate, that are credible, that aren't going to corrupt the cultural perception of therapy, both for animals and humans. And obviously we're doing a lot of that as best we can on the especially on the MSK side with MSKR, etc. But also that's our word through Physio Matters. So I'm really pleased that we've been able to sort of hear of your work doing very similar things over there, which of course we support. Could you tell people a little bit about how they would best look into this, if that's something that they're fancying, they've got questions to that effect?
Well, yes, if you go to the ACPAC website, that's probably the first place to go and have a look. So in the UK, we've got two programs. So I program manage obviously the best program at Hartpury University, but there is also a Liverpool University run a veterinary physiotherapy postgrad diploma and masters there as well. So there are two options in the UK. So yeah, just get in touch with us. If you go to the Hartpury University website, which is hartpury.ac.uk, then you can link to contact me there and I can answer any questions about our programme.
Fabulous. So for those of you that have enjoyed our Animally shows and want to hear more, of course, go to acpot.org to find out more. But also let us know, info@physio-matters.com if you want to hear more. I doubt you want to hear more from us. You want to hear more from them. But can we help ACPAT to facilitate some more broadcasts and help them to boost their profile? Absolutely, that's what this is about, and so we're happy to do that in the future. But fundamentally, it's about making sure that we recognise and understand the difference between the Wild West cowboys that are out there that could otherwise, at worst, be being unsafe, but even at best, they are someone that is ungoverned. And that's something that is, of course, a relevant distinction between that and our ACPAT colleagues. So thank you so much for joining me today, Gillian. We're out of time for now, but hopefully we'll chat in the future, and good luck with everything.
Thank you very much for inviting me.
Cheers, no bother. No, in the absence of our outro and the loud music that we usually finish with, it means that me and Gillian, I'm going to press end, and then it's usually a few seconds, so we're going to awkwardly wave and smile.